When you're facing a cancer diagnosis, the path to treatment can be overwhelming, but there is a vital role in cancer care that often goes under the radar: the Oncology Nurse Navigator. Oncology Nurse Navigators guide patients every step of the way, offering support, information, and coordination between doctors and specialists. Today, the Oncology Nurse Navigators from Trinity Health are here to share insight into their role. We've got Katie, Grace, and Rachel here with us. Ladies, thank you so much for being here.
Thank you for having us.
So let's dive a little deeper. Tell us what exactly is a nurse navigator?
Well, an Oncology Nurse Navigator is a specialized nurse who helps guide patients through their entire treatment journey. So we coordinate care, offer emotional support, provide education, and really help patients better understand their diagnosis, treatment plan, and next steps.
Yeah, it's such a valuable role. I think that people don't really understand it until they're actually sitting there and they are the patient, how important it is to have someone walking by their side. Talk to me about why you got into this, what you love about it, because I think it can be probably a challenging role for you.
Yeah.
So when someone's diagnosed with cancer, it can be so overwhelming and scary. There's a lot of fear and anxiety that goes along with it. And it's easy to feel lost in the complex world of cancer. So as nurse navigators, we are there to offer support and guidance. We walk alongside our patients and their family members every step of the way throughout their cancer journey, so they don't have to feel alone. They know they have a go-to person, support person. We help address and help them overcome any barriers which could prevent them from moving forward with their cancer treatment by connecting them to resources and support services. We help eliminate confusion by coordinating care between the multiple specialties just to make sure that treatment plans run smoothly and in a timely fashion.
Yeah, because talk about how many different doctors and different places sometimes patients have to go when dealing with a cancer diagnosis. There are a lot of moving parts.
There's multiple. Yeah. You have surgical oncology, you have medical oncology, you have radiation oncology. So navigating through each of those different specialties, having somebody who knows those areas is very helpful.
And so how does it work from when a patient comes in and has that cancer diagnosis? Obviously a very scary time. How do they get paired up with a navigator? And do you follow them? Like, what does that look like for them?
So generally we'll meet patients either at diagnosis or shortly after diagnosis. Oftentimes we're doing even work before they even come to our office. So we're aware of these patients and making sure that everything is teed up and lined up for their first consult, whether that be in radiation, surgical, or medical oncology. And then we follow them through survivorship as well, just making sure that they're plugged into all the places they need to be plugged into.
Right, because it doesn't end when treatment ends. Your cancer journey is a lifetime.
Yeah, it is.
So let's talk about that. So, they get through all of the things, they have their navigator with them. Talk about what the next steps are for these patients and why it's so important for them to have you. I feel like you might be like a part of their family by the end, right?
Yeah.
Well, I think at the end of at least the active navigation journey, we ensure patients are all set with future follow-up with all the different specialists. And then most importantly, always feel comfortable to reach out to us in the future with any needs that come up along the way.
That's wonderful. So, I appreciate you guys so much. I've had family who've gone through these journeys, and the navigator really helps. It's a roadmap, really, for you, and then someone should walk with you. Is there anything else you want to share about what you do and why it's so special and valuable to the patients?
Well, I think just being that safety net, that advocate for the patient, and someone who knows the medical system to be able to navigate them through, hopefully as smoothly as possible, and again, just be that support to them when they may not have anyone else in their corner.
Absolutely.
And really being an advocate for them too. That's part of it as well, is some patients don't have advocates and don't have that support on their side, so just being that voice for them and somebody who sees the whole picture as well.
Yeah, and it's really hard to advocate for yourself sometimes too. And then, obviously it must make it so much better for the patient in treatment to not have that stress over them of trying to figure out and do this themselves.
They appreciate so much having a support person and a go-to and someone they can call and get through to right away and not having to figure out who to call for what. They're like, I'm just going to call my navigator and they will help me. So.
And to be able to focus on their treatment.
Exactly, right? That's the goal, get them healthy.
Yep, I always tell my patients, if we can take a little bit of stress off your shoulders, that's what we're here for.
Yeah.
Wonderful. Well, thank you guys again. I appreciate
you.
it. Thanks for sharing your story.
you.
There are the cancer care locations through Trinity Health, the LAX Cancer Care Center, all inclusive there, and then the Trinity Health Johnson Family Cancer Center. You want to learn more about their programs, you can always give them a call, 616-685-5600. We'll be right back.